Gracias. Voy a hacer la presentación en español.
I'm going to do my presentation in Spanish. First of all, I would like to say thank you to the organizers for their invitation to this very interesting conference. Neurostimulation in the brain has a debt with pacemakers and the work done by cardiologists. The audience here is not specialized in neurosurgery, so please let me explain to you what neurostimulation techniques are. First of all, what applications they have and what current challenges we face today. Right, neurostimulation is delivering small amount of electricity on or inside a nervous structure with a view to changing its function and so getting a therapeutic effect. Together with the infusion of drugs, we find the concept of neuromodulation, which seeks to change the function in the nervous systems. They are not really prostheses, but they are implantable devices indeed. They are not prostheses because they do not replace functions. They work with impaired functions. Let us have a look at the neurostimulation systems. All neurostimulation systems have almost the same components. Some electrodes, in this case, they would be applied on the skin where in pain, and a generator connected to the electrodes with a lead, a cable. We take into account the number of pulses in hertz and the amplitude of the stimulus in volts and the width of the pulse, which is measured in microseconds. On the other hand, if we focus on a more sophisticated system of neurostimulation implanted in the brain, here we find the same thing. Basically, we have an electrode which delivers an electrical impulse on the brain and a generator which is fully implanted. The patient has no peripherals or no devices outside, and there is a cable towards the generator. The calculations are the same. However, here, since we have more electrode contacts, well, you may choose 1, 2, 3, 4 contacts, bipolar, cyclic. You can play a little bit. The stimulation parameters in the case of the generator implanted in this particular region can be changed by means of an external device and then transmitted on the basis of radio frequency. I said earlier, deep brain stimulation was made possible thanks to the development of the pacemaker. The first implanted pacemakers were implanted in the 1960s with Professor Heath, Professor Sheely. 2 electrodes were implanted in the brain in gray matter areas deep in the brain. They could be used for different purposes, as I will show you later. They could be bilateral or unilateral. In 1965, this paper was published in Science, in the journal Science. It is a key paper in the physiology of pain. This paper provided scientific foundations for the use of neurostimulation techniques. In 1969 and later on, other stimulation procedures were introduced, applied on other nervous structures. In 1977, spinal cord stimulation on the membranes covering bones in the posterior space, where you can use 8 contact electrodes or 2 electrodes by means of 4 contact points, or other electrodes required open surgery for their implantation. In 1967, Websip and Sweet introduced peripheral stimulation techniques on peripheral nerves. These techniques have evolved over time. They are used in epilepsy treatment, and instead of implanting electrodes upon the skin, here the electrodes are implanted subcutaneously to stimulate nerve endings. In 1977, Meyerson and Hankinson introduced the stimulation of the Gasserian ganglion. This is the nerve that makes our face be sensitive, and this stimulation has been used in pain treatment. Some of these techniques boomed at the time, but were superseded by newer techniques. Some of them are actually not used at all currently. We could also talk about nerve root stimulation. This technique was introduced in the late 90s. It sought to focus stimulation on really specific sites instead of covering a large area. And finally, in 1991, Tsubokawa, a Japanese surgeon, introduced the stimulation of the motor cortex, where the electrodes are placed here with a view to treating pain. So these are the different techniques. Some of them are still used in stimulation. Obviously, I'm not going to cover surgical aspects, but where and in what cases are these techniques used? Well, basically in the impairment mobility courses and in pain treatment. It is now being used in psychiatric neurosurgery, also with epilepsy, and in other cases too. For instance, in Parkinson's disease, in this case, the electrode is placed. Well, this is a deep brain stimulation. The electrodes are introduced in the subthalamus nuclei. It is used for pain, for the tremor too, or in other cases of trauma or neurological impairment. In this case, we use deep brain stimulation in a particular site. These techniques are prescribed when drug treatments are not effective, when drugs are not an alternative. So they are really prescribed in case of drug failure in controlling the symptoms. Another use is in dystonia, and it has been used with other mobility disorders or impairments such as the Gill condition, or in the secondary spasticity derived from other conditions such as multiple sclerosis. With regard to pain, the main indications are in neuropathic pain. Neuropathic pain is caused by a lesion in the nervous system. In this case, electrode implants are being used in different sites depending on the area of the pain. The peripheral nerve is stimulated, or the root could also be stimulated, or other areas in the brain. Another type of pain, the complex pain regional syndrome, formerly called symplegia. It's this type of pain results from injuries in the peripheral area in patients